The view from here might make it hard to see. A community within our community. Unmanaged mental illness changes that perspective.
It's a lonely one.
It's hard to move forward from here.
I've been by myself most of my life.
And easy to get stuck.
Nobody around me, really.
Going in circles. Mental illness and substance use disorders can take a bright future.
To job corps in Clearfield, Utah.
And put it always just out of reach.
I would strongly suggest maybe staying at the mission or someplace, or maybe talk to Marcy at the rescue or at the crisis center about maybe she let's stay a night there. Okay.
The Billings Police Department has 3 downtown resource officers who spend their days out here too, making laps around the community.
Okay. Where'd you stay at last night?
Checking in on familiar faces, living a familiar pattern. It's not easy.
As far as law enforcement goes, it feels like we're kind of stuck in the middle. On one hand, we're trying to serve the downtown businesses, make sure everyone downtown feels safe, and at the same time, there are people who are suffering from mental health issues, trying to get them the help that they need.
When a crisis occurs, officers are expected to find a way to handle it, and they deal with the same people and resource limitations over and over.
I know we've had issues with the state hospital. People actually get committed, sent there for a short period of time, and then they just bust them straight back and kind of drop them off at the rescue mission with no caseworkers or anything like that. So she'll have some sort of manic episode to the point where she needs to go somewhere. We tried taking her to the crisis center. She was above their level of care. So then we took her to the Billings Clinic, even though she wasn't suicidal or homicidal. And I think she was out of there within a couple hours from there and kind of just back on the street.
The Crisis Center is a collaboration between hospitals and mental health care stakeholders in the community.
They are full, and there's a lack of staffing on some of the organizations that we work with. Those waiting lists get longer and longer.
Many places use their jail as a shoe-in alternative for people in a mental health crisis, but overpopulation at the Yellowstone County Jail limits that option as well.
Even if they have committed a crime, it's usually still not an option. Unless that crime is violent, and then the jail might keep them. And most of the time, it's not a place where they need to be to begin with.
This community.
If I walk these streets again.
Within our community.
Back and forth, back and forth.
Going in circles. In Billings, Augusta McDonald, MTN News.